Hi, this is Reggie from Restore Plus Physical Therapy, and welcome to today's tip of the day. I want to share with you one thing that I don't want you to do after you had knee surgery, because I've had patients, I frequently have patients who undergo surgery. Knee surgeries are very common. Now, after surgery, there's a few things that I would want the patient to do, such as move the leg, exercise. It all depends on what is allowed by the doctor for that specific kind of surgery. But there is one thing that across the board, almost all kind of surgeries with the knee, with all kind of knee surgeries, there's one thing that I want you to avoid doing, and this is something that I would not recommend you to do, or actually I would recommend for you not to do. All right, let me show you. And this is when you lie down, because a lot of times when you had knee surgery, you're tired, you want to fall, everybody sleeps. So sleeping is very important. The question is, how do we get comfortable when sleeping? After knee surgery, when you keep your knee in a straight position, that's a very uncomfortable way to sleep. Your knee's gonna hurt because the two bones come together. All right, so now how do people sleep? Let me show you. So let me get on the bed here. Okay, so for example, when you're sleeping, all right, a lot of times this position, let's say I had surgery on my left knee, this position will be very uncomfortable because it's straight. The bones come together, and what happens is there's no room for the inflammation, and it will cause pain. So what people tend to do, they bend it, because when you bend it, there's more space inside the knee. The bones are more further apart, and there's more space for the fluid, for the inflammation, so less pressure inside the knee. People tend to do this a lot to get to a position of comfort. So when they're sleeping, they're either will move your leg out like this where the knee is bent, or they would actually be putting pillow or towel under the knee, keeping it bent like this. All right, but when you keep it bent for a prolonged period of time, the tendons back here, the hamstrings, it will shorten. It will adjust to that position, and when it shortens, you're gonna have a hard time extending the knee. And not only that, the knee joint itself will stiffen up in that bent position. And when it stiffens up in that position, you're gonna have a hard time straightening it. So what will happen is when they start coming for therapy, I will have to straighten it, and it's gonna be a painful process. And let's just put it's not gonna be fun. All right? So that's a very crucial thing. It's good for you to get some rest. Your body will need it to heal, to recover, but you cannot do it with your knee bent. When you keep your knee straight, yes, it's gonna hurt. It's gonna hurt for maybe a few days to a week, but once the healing starts setting in and your body gets used to that position, it will go away. And that's what I tell my patients. So you have to just bear it a little bit at the beginning, get through that phase, and then it's gonna be less painful. All right, so that's one big thing that I don't want you to do after you had the knee surgery. So feel free to share this with your people you know, your loved ones. I want to be able to help them, especially if they just underwent surgery. All right, let me know what you think of this video. Let me know if it benefited you in any way. Leave your comments below. All right, you can subscribe to our YouTube channel for other tips and other videos. You can like us on Facebook or follow us on Instagram. I'll see you in the next video. Bye.